The two most common agents that, in terms of breast cancer, and the ones that are most active in that setting are going to be your taxanes, which are frequently used as a first-line agent for patients with metastatic breast cancer. Women who have not seen an anthracycline before can be considered for an anthracycline, as that's also a very active agent in breast cancer. However, I would say, especially in the hormone receptor positive, HER2-negative subset, women that are progressing through hormonal therapy and have exhausted their hormonal therapy options often will get an agent like Xeloda after having transitioned or failed off of these other endocrine treatments, because it's oral. So that's one thing that they like. Patients kind of prefer to be able to preserve their quality of life and not necessarily have to go to an infusion center repeatedly. So they may get an oral agent like Xeloda, which also doesn't cause hair loss and can be quite active in this subset of women with hormone receptor positive HER2-negative disease. So that's a common scenario that pops up more and more now too, is that you'll see women potentially get Xeloda before they get a taxane in the first-line setting. So those are a couple of the single agents that are used, up front. And then subsequent lines of therapy typically will depend on what kind of comorbidities or toxicities the woman has from her prior lines of treatment. But agents like eribulin are frequently now used in, say, the third-line setting after women have received multiple agents for their disease. And those are kind of more popular agents now in use for women with heavily pretreated disease.